So the other way to apply compressive dressing is to use a shrinker sock or an elastic sock. A lot of these come prefabricated, some of them are color coded, they have to be sized properly. But in general, once you have a shrinker garment like this, that's the proper size and design for that patient, they are a little easier to do than the ACE wrap, a little less foolproof, a little more foolproof to put them on. So the trick again is to create a tension where you're tightest distally and get looser as you move proximally. These types of socks typically not put on when someone still has a fragile wound. If you're looking at someone with tenuous closures, staples or sutures aren't looking very good. Remember, a lot of these people don't heal well initially. You might see a lot of eschar, a lot of drainage, things like that. By far, you want to stick with ACE wrap for those types of patients. But if someone still has edema problems when the primary healing looks good, the suture line is well approximated, sutures may still be in, but it's not going to go anywhere, you're not going to damage it, then you can certainly apply one of these type garments. Now the trick is to put the distal end on first. So I put it on my hand like this, I invert it about 2/3 the way, and then I put my hands in there and I really stretch this out so I can see the bottom of the sock. Now imagine there's a suture line here, and the suture line typically isn't at the distal end. That's a fish mouth closure. Typically, in this part of the country anyway, we see what we call a posterior flap, where they take these posterior calf tissues that are nicely vascularized and they bring them around the distal end, and your suture line is kind of anterodistal, like that. Remember, you don't want to pull that suture line. So what I'm going to do, I'm going to take this ACE, pull it out nice and wide like this, and I'm going to come a little bit from the bottom and scoop it. And as I scoop it, I'm relaxing the tension on that suture line because I'm bringing those posterior tissues up towards it rather than dragging across it. And once I cover the bottom, now I give a nice strong push forward. And typically that's when there's any tenderness, the patient's going to let you know. Hold it there a minute, let them catch their breath, right? And you've really got this distal end on nice and tight. And now you can put this on loosely by just loosely pulling up the rest like so. Remember, you don't want to stretch the top part really hard like this because you don't want to give a lot of tension up here. Instead, you want all that tension distally down here. You don't want any gapping like this, right? Because again, if you have an elastic sock on and it's pulled down loose down here, you're tighter here and looser here, and again, you're going to push fluids in the wrong direction. So very, very important that these things get put on so that the distal end is always the tightest. One more time. I'm going to open it up nice and wide. I'm going to kind of scoop the back a little bit, right? So I'm pulling up and then pushing like that, nice and firm. It goes out, out, out. That's okay. Breathe a little bit. And then once that's in place, just gently pull up the rest. Try not to get any wrinkles. And there you go. One nicely applied shrinker sock or compressive sock. So with that, that should wind up what we're doing here today. Hope you all learned something. And again, I'm looking forward to seeing you all in your classes.